Hello, very good afternoon. The Prime Minister has announced a long-awaited package of funding for the NHS and social care in England amid accusations that he has broken an election promise. Speaking in the Commons, Boris Johnson said that COVID had placed massive pressures on the NHS and that national insurance contributions will rise from next April to help pay for the NHS and the care system. The rise, opposed by Labour, is highly controversial among Boris Johnson's own MPs because the Conservative manifesto had pledged not to raise taxes. So let's take a look at what the Prime Minister has announced this lunchtime. There is to be a rise of 1.25 percentage points in national insurance. That applies from April 2022. It means, for example, that someone earning £30,000 a year will pay an extra £255 annually. From 2023, that amount will be known as the Health and Social Care Levy. The increase will also be paid for by first-time workers, by workers who have reached retirement age. The Prime Minister said the new Health and Social Care Levy will raise £36 billion over 3 years. It'll help tackle record NHS waiting lists. There have also been announcements about social care costs. Lifetime individual contributions will be capped at £86,000. That is the maximum that any one person will have to pay for care. No one with assets below £20,000 will have to pay for their social care costs. And there's to be means-tested help from the state for anyone with assets between £20,000 and £100,000. Well, the government is also increasing the tax on dividends. That's income paid out by shares. Again, an increase of 1.25 percentage points. As we say, it's emerged that MPs will vote tomorrow on the government's plans. Well, let's get a little bit more on all of that from our political correspondent, Peter Saul. A lot to try to digest there, Peter, and it has to be said, an awful lot of details still to emerge. But the bottom line, if you're looking at a manifesto, is we have got broken promises.
Yes, I suppose it's one promise fulfilled at the expense of having to break another, isn't it? This was the thing that Boris Johnson promised on day one of becoming Prime Minister, that he wanted to solve the social care crisis. So yes, we have the details on the cap on how much people will have to pay during their lifetime, the sort of lower threshold as well. But there's still a lot more potentially to iron out in the next few months about support for training for people who work in social care, for example, improving the overall service. Some concern in the debate in the House of Commons too that initially the money that will be raised through the tax rises will go to the NHS for the first 3 years, largely, before being gradually transferred over to the social care sector. Now, what will the NHS do once it's lost potentially that money? So there's still quite a few questions swirling about this. And although there had been a fair amount of criticism from not just the Conservative backbenchers, but within Cabinet on this, today the criticism from his own side, at least, was fairly muted. So I think Boris Johnson will be certainly quite pleased in that regard.
All right, Peter, we'll talk more a little bit later. Let's just get a summary of everything we heard in the Commons from Ione Wells.
It's haunted successive governments. How to fix social care so thousands of people don't end up selling their homes to pay for it. Sharon's mum sold her house to fund her staying at a care home for her dementia, but that money has now run out.
I mean, I try to be jolly and, bubbly when I'm with her because it's not for her to worry about, it's for me to worry about. I will find that money, but I must admit, I would only hope that Mum doesn't live too long because otherwise I'd be bankrupt as well.
We love NHS on social care. Brilliant.
It was one of Boris Johnson's first promises as Prime Minister that he'd fix the crisis in social care with a clear plan he'd prepared. More than 2 years later, he's presented a plan to his ministers and a tax rise to go with it, breaking one promise they were all elected on.
Which taxes are you putting up?
The answer? National insurance, which will rise by 1.25% to raise billions for the NHS COVID recovery and social care reform in England.
It would be wrong for me to say that we can pay for this recovery without taking the difficult but responsible decisions about how we finance it. As a permanent additional investment in health and social care, it would be irresponsible to meet the costs from higher borrowing and higher debt. Yes, I accept that this breaks a manifesto commitment, which is not something I do lightly, but a global pandemic was in no one's manifesto, Mr. Speaker. Speaker.
Labour haven't set out their own alternative, but the opposition, as well as some Tory MPs, think this is the wrong way to cover the costs.
The pretence that the Prime Minister is only here because of the pandemic is not going to wash. He's putting a sticking plaster over gaping wounds which his party inflicted. He made that commitment on social care before the pandemic, and he said he would pay for it without raising taxes before the pandemic.
The scandal of the tax hike is it will fall hardest on the young and the lowest paid, the two groups who have suffered the worst economic consequences of the pandemic.
The tax rise is UK-wide, but the plan is England only. Other nations can set their own and will get extra funding too. In England, the plan is no one will have to pay more than £86,000 for care in their lifetime. Anyone with assets less than £20,000 will have their care costs fully covered by the state. It's a version of a plan proposed by Sir Andrew Dilnot, who advocated a £35,000 cap on care.